Hello, this is Joanne with Crecer Sin Barreras, and today we're going to speak about the element of air. And I am so happy to have Bobby here with us, Bobby Ardila. He's a physician associate. And Bobby, I know that besides being a physician associate, you also have other credentials, and there are decades and a lot of them. So can you just tell us just a little bit about them?
I've been fortunate enough after basic graduate medical training, and I continued on, and I went and did entered two fellowships, one in oncology and one more recent in integrative medicine. So integrative slash functional, which is what I do now, has allowed me, a huge jump and a segue from the integrative training has allowed me to see things from more of a functional as well as feeding off the integrative fellowship because it is a recognized entity in the spectrum of medicine.
And I love Bobby's background because it definitely helps us understand things a little bit better because he has different perspective. So I asked Bobby to help us with the element air because I know that he has been in so many different environments and in so many different situations. So I want to know, Bobby, what does air mean to you when you think about air in general, as far as health, as far as just the element itself?
So I think when we talk about air is we won't be alive without the air around us. And I think when we you had mentioned to me, it just sparked the necessity to recognize how important it is for the air that we breathe around us. And probably it's without really getting into the weeds, it more of interest me being a veteran of the military and dealing with veterans. A lot of concern dealing in harm's way in the combative theater, where a lot of us were exposed to different gases and mixed within the air that we were breathing, which led to other conditions. You've heard of Gulf War syndrome and had mentioned that,
Yes.
and other conditions that we see from a pulmonary standpoint, but things that can actually be transferred via air and affected to where they actually go in our skin. They go in our lungs for what we're breathing and affect our physiology and our hormonal disruption, which is a big concern as I do bioidentical hormone replacement and see a lot of our guys in the military that have come back from overseas with a lot of inflammation and disruption, not just from certain post-concussive blast injuries, but also the air.
So with that, say for people that have been exposed for just on a daily basis, I know that as we walk through life, we cannot escape air, which without air, we're nothing if we lose the air. So just for health side of it, something that we can do to help the quality of our air on a daily basis.
Well, that's a very good question. I have patients and colleagues that when we've talked about this, you might have heard certain filtration of air, a HEPA filter. There's certain other ones that to use within a household that can clean, purify the air. I would say where it really benefits somebody is dealing with seasonal allergies.
Mm-hmm.
So if they don't have a controlled system within the household or where they're residing, and they're more reactive, these allergens and proteins come in that some people react to, can lead and have an exacerbation of an asthma-like episode, whether they have asthma as a diagnosis or not. In those cases, and just in general, keeping your air cleaner because that's what we're breathing in. And that oxygen carrying capacity, once it reaches our circulatory system by capillary involvement, is we want good sources of oxygen, if that makes sense. So,
And what, for example, when you say good sources of oxygen, I know that as a norm, I like to do certain food, certain things that help in a daily basis. Like I like to take a shot of chlorophyll because it brings oxygen into the blood. And by bringing oxygen, it helps my body function better, it helps my immune system, and it's also a healthy deodorant for the actual body. So, is there any tips? I know the once you inhale certain air, your hormones can be unbalanced. And with your background, what do you think would be good for the average person to do on a daily basis? Something simple, something that is not that is tangible for most people.
So to give you an example, I think just from a conceptual standpoint, like we're breathing air in here. This is a clinical setting, so it's good air, as opposed to somebody that's in a garage, multiple mechanics, cars are running, so you're getting a lot of that exhaust. Okay, so obviously we don't want to breathe that, and the carbon monoxide concern. So obviously that's a little extreme on one end of the spectrum or the other, but at least you get an idea.
Right.
What are some of the things that we could benefit, or how to increase and improve that? I really believe in what I do with patients, especially if you know that you're dealing with toxic air, for example, like in that setting, like a mechanical setting. If a patient, aside from that, in other words, I encourage what kind of exercise that you're doing aerobically to challenge your lungs outside or away from work, because that's always a good thing, because then you'll have increased turnover. You're giving the lungs a capacity to expand as opposed to being stagnant. And a lot of times with some of these things that we're exposed to, without getting into concerns like asbestos and asbestosis and mesothelioma, that basically interfere with the capacity of the lung to expand. So the more that you can challenge that, knowing that you are in toxic or subtoxic environment, then you're keeping the function of that lungs that's conducive for optimal health, and that's what we want.
And something that I know that I like to do for my lungs is I love doing hot yoga. I love doing breath work, doing certain things that are very extremely simple in a way. But of course, you got to get out there. You have to do the work. You have to program your body to say, hey, I want to be able to do this to help my system. And I know that one of the things that helped me a lot is yoga, because you do the breath work. And when you do the breath work, your body functions better. You help your immune system. So what are the ways that we can help our immune system through breath work?
So I'm glad you brought that up. It's one thing I learned with Dr. Angel Wild in my second fellowship in integrative medicine is the importance with breath work. And I like the fact that you bring up, and I know that you're active with yoga, and I make that part of my life, even participating with hot yoga. It's one form. In most yogas, there is this meditative component to where you're controlling breathing with functionality and movement with the body, which is really important. I do my own is a power yoga routine, because I really believe in what it's doing with connective tissue and the injuries that I sustain from sports and in the military. So the more that you can do that is you're countering ongoing or the chronic nature of inflammation in the body. You're not relying on, here's some medication you take, but you're taking an active role in accountability in something, whether that's sports related. And yoga, some people consider it as a sports or as a modality for training. And I think in this case, like what in how you're reflecting on it is really beneficial. And I've heard this and recommend with other patients to try it. And I get benefit myself with it.
So once let's say we get harmed from the elements, which happens all the time in a daily basis, one of the other things that I like to do is just be around trees, be outside, be on the beach, just breathing that perfect, beautiful air. But once you mentioned something earlier that your hormones can be imbalanced just because of the quality of the air. What would you tell us that would be the best thing for that?
So it's interesting. We don't have a clear, full understanding, other than we know certain things that we are exposed to, and we know by virtue of us breathing in and getting the oxygenating sourcing from the air we're breathing, that's somehow it's passing past our blood-brain barrier and affecting our pituitary axis, where hormones are being formed and in right quantities for the body, for both men and women. Some of the things that we could do, like you're saying, I think it's great to the fact that incorporating that breathing component, like with yoga, even athleticism, where you're going out, like I enjoy certain aerobic activity, going to the gym. If that means going on a treadmill, going on an elliptical, increasing that heart rate and increasing the oxygen demand. Because then by doing that, you're turning over in an optimal environment, and you're challenging the body. Whereas certain inflammation caused by some of these proteins, let's just say in the lining of the lung, if you're not expanding and moving them, they're going to stay there and they're just going to do their disruption and cause inflammation and otherwise.
I love how you put that. So I would want to ask you if you can give our listeners one advice as far as taking care of themselves. Just do one little thing that is going to help you on your daily basis, just to help with the quality of your air, to help the oxygen in your body. What would that be?
I would say, apart from what you're doing work wise, doesn't matter if you're blue collar, white collar, if you have a really rigorous, demanding, physically demanding job, to take that time at the end of the day, go with your partner, go for a good walk, and then focus on your breathing and see how it is different than throughout the day in relation to your movement. That's probably the biggest thing that I would say. See and focus and see how really important your breathing is and how that is in relation to walking or other physical activity. That way you hone in and become more accountable for your body. And hopefully you can see the benefits with that. And that can trigger a response to where you really want to get on a physical activity program that can really benefit your health and wellness and quality of life.
I love that, because it's something that you don't have to reinvent the wheel. You don't have to do anything. All you have to do is go outside and go for a little walk. So thank you guys for listening. Thank you, Bobby. It was a pleasure as usual. And we'll talk to you soon.
Thank you.